today, Undercurrent, we have a big name from Perth, who is the plastic surgeon and cosmetic surgeon, Dr. David Colbert. Dr. David Colbert is the member of Australian College of Plastic Surgeon, and he is the member of Royal College also. So today we are here to ask his big achievement and what he done for the plastic surgery in Perth. We are going to ask Dr. Colbert. Hi.
So I suppose achievements at Royal Perth Hospital, I'm involved in the training of junior plastic surgeons. So it's something I'm quite motivated about. So 2 days a week on Tuesdays and Fridays, I operate there and help train the junior, plastic surgeons who are, in their training and develop new skills, and also look after patients with their complex head and neck cancers and also hand trauma. And then other things from Monday, and Wednesday and Thursdays, I operate in private. And there I perform all aspects of plastic surgery, reconstructive and cosmetic, from breast augmentation to breast reduction to facial surgery and all skin cancer surgery.
Like you are part of different members for the Australian College or different members in different fields of cosmetic surgery or plastic surgery. What the research you are more bringing for the newcomers or for the new students?
Yes, it's important to be associated with membership. So I'm a member of the Australian Society of Plastic Surgeons, also the Australian Society of Aesthetic Plastic Surgeons, and also a member of the Royal Australian College of Surgeons. So these are ways of ensuring that legislation and that essentially the practice of surgery and practice of plastic surgery is performed in an ethical manner. So it's important to ensure that your surgeon is a member of these boards, and it helps ensure that patient safety is essentially the number one priority.
What do you say about the plastic surgery is good for health? What do you say about something about that?
So I think plastic surgery, I suppose it can either be cosmetic or reconstructive, and sometimes both. I think plastic surgery's benefit is when sometimes people don't, if they feel they don't look as well as the same as they feel. So sometimes people, might feel like they're a younger age, but then when they look in the mirror, there might be something about them that doesn't mesh the same way. And I think that's sometimes where cosmetic surgery might help. But there's also a lot of operations that, from plastic surgery point of view, can help from a physical point of view. So, for example, a classic one would be breast reduction. So people with very large breasts can have back pain, posture problems, difficulty exercising, difficulty finding clothes, plus all the psychological problems of having large breasts. And breast reduction is an operation that, as well as making the patient's breast potentially look more aesthetic, can also help from a functional point of view.
How you treat patient here?
So important part of treating any patient is first always take a full history, including their motivations for plastic surgery. Always make sure that their motivations and their what they want are similar to their expectations, are proportional to what's actually wrong with them. After that, always take a full history, making sure they're safe and that the operation is actually required and that they're safe to undergo the opreation. And then following that, a full examination, including the area of deformity, and always measuring and quantifying about what they've presented with.
Every week, how many patients you most of the time just check every week?
So on Wednesdays, I consult from usually 8 a.m. till 5:30 p.m. So it just depends on the complexity. So each patient I see by myself, and anywhere from 30 minutes to 60 minutes. And between that, I then also follow up patients that I've previously operated on.
Thank you very much.